I would like to introduce and welcome the Honourable Tanya Plibersek.
Good morning, ladies and gentlemen. How are you? All good? I want to thank Auntie Agnes Shea for that welcome to country. It's always great because Auntie Agnes doesn't just give the formal welcome to country, she always starts with a few words of wisdom. I think that's always lovely to listen to. It's wonderful to see so many of you here today. I want to acknowledge the parliamentary colleagues who are here this morning. Professor Murto, the patron of General Practice Registrars Australia, Dr. Ed Vergara, who welcomed me, Chair of GPRA, Amit Vora, GPRA CEO, Chris Timms, Chair of the General Practice Students Network, the Going Places Network, and representatives of General Practice who are contributing to today's event. Welcome all of you. I also want to take a moment to congratulate the GPRA, the General Practice Students Network and the Going Places Network for hosting this conference. I understand that there are now 20 GPSN clubs in 20 medical schools across Australia, and they're working hard to foster interest in general practice. The Going Places Network is also doing a fantastic job encouraging pre-vocational doctors to consider general practice as a career choice. We can't underestimate the importance of good guidance and support in the early stages of the development of a person's career. The work being done by GPRA and the networks is supporting your profession, your workforce and individual clinicians to be the very best they can be. I noticed Auntie Agnes talking about how Indigenous communities need more GPs as well, and I think that was a point very well made, Auntie Agnes. Thank you. Thanks for inviting me to address your conference today. The theme, General Practice in the Hot Seat, is very appropriate because you are in the hot seat in a very real sense at the centre of the action when it comes to primary healthcare reform. Primary healthcare reform in Australia cannot happen without the support and involvement of general practice. And I believe that together the Australian Government and GPs share the same objectives when it comes to our national health reform agenda. We both want the best quality healthcare delivered to Australians when they need it and where they need it. And we both want to build the capacity of the health workforce and the health system. We want our reforms to be sustainable, real lasting improvements in the way that we do things, in a practical, on-the-ground way, making a difference to people's health and well-being. None of these things can happen in any meaningful way without the involvement of GPs. We know that GPs are the essential lifeblood of our health system. Primary care is part of the health system. It's the part of the health system that Australians use the most, and it's crucial in ensuring that individuals and communities get the healthcare they need, where they need it, when they need it. We are committed as a government to more convenient access to primary care, including after-hours care. We want to support GPs and other primary care professionals to work in multidisciplinary teams that make the best use of the specialist skills at each point of the healthcare continuum. And we want to improve the quality and convenience of care through e-health and telehealth. The After-Hours GP Helpline is an example of a very successful general practice initiative, recently notching up over 100,000 calls in its 7 months of operation. By being able to speak to a GP after hours, 2 out of 3 callers are receiving the advice they need over the phone without having to wait for a face-to-face consultation. It's most practical if you can imagine in the middle of the night you've got one child sick and a couple more children in bed, having to raise the whole family to go to the local hospital or to find a 24-hour GP service is incredibly difficult for parents and families. It's just one example, but one I'm very familiar with the difference that this GP advice available at the end of the phone line has made for people. The government's investment in GP super clinics and primary healthcare infrastructure is also helping GPs and other professionals to work more effectively together in a single location. Medicare Locals, another initiative, will also help primary care providers to work together more collaboratively. Building on the work of the divisions of general practice, they'll bring together GPs, allied health professionals and consumers to identify needs in local communities and work out how, at a local level, those needs will be met. This means more convenience for patients, it means improved facilities and enhanced training for the next generation of doctors, nurses and allied health professionals. E-health is another important and I believe very exciting area with great potential to improve the convenience and quality of care for patients. It's also an area where we believe that GPs will need to take a leading role. I'm pleased to see that the e-health subject will feature later in your discussions and that you'll be hearing from Mukesh Haikerwal. Dr Haikerwal is the National Lead Clinician with the National E-Health Transition Authority, NETA. His role is a very important one in the delivery of e-health for Australia. From July this year, we'll be opening the doors for business, with the Australian Government starting to roll out the personally controlled electronic health record. I think it's important for people to understand that the 1st of July date is the date when people's personally controlled e-health record numbers will become available and people will be able to begin to register for their PCEHR. It's not a flip the switch date when every GP in the country will be talking to every other GP in the country electronically, but it is the foundation, it is the beginning of rolling out an e-health system for Australia. The system will help us join the dots over time between GPs, pharmacists, specialists, allied health professionals, hospitals and patients. E-health records will mean faster and easier access to patient information so that GPs can spend more time delivering services, talking to their patients rather than chasing records. It's an important way of making sure that people who are visiting a number of healthcare providers will each know, for example, what the other providers have prescribed, the other tests that have been ordered. Of course, online health is already happening in many locations and telehealth is being supported by the government in many locations as a cost-effective and convenient online alternative to traditional face-to-face medical care, and it's proven very popular with patients. And one example is an older patient, for example, in a non-metropolitan area who requires post-operative monitoring. The potential for telehealth to transfer their delivery of care is enormous. I've seen a number of very exciting telehealth projects where patients who've had initial care with a GP or a specialist are able to talk further, even from home, with their doctors, to talk about whether medication is working, to talk about whether they need to tweak some of the aspects of their care, rather than, particularly if you're talking about people who need to travel hours to see their doctor, they can do that from home, making a great deal of difference to them. It means that people also don't put off medical attention. People who live in regional areas may often not want to travel those extra hours themselves. They might not want their carer to take another day off work to take them hours to the doctor. So having telehealth available in those circumstances can mean that people access health care more often when they need it rather than delaying talking to their doctor. From mid-last year, Medicare rebates have been available to patients receiving telehealth services in non-metropolitan and outer metropolitan areas, in residential aged care facilities and in Aboriginal medical services. GPs are able to be actively involved in telehealth service delivery with rebates available for GPs at the patient end of a specialist telehealth consultation. We're looking to get GPs even more involved in telehealth services by investing over $20 million in an NBN-enabled telehealth pilot program. The program will fund innovative projects that can demonstrate the benefits of telehealth service delivery in the home. It will focus on aged care, cancer care and palliative care services in areas where the NBN has been rolled out. I want to turn now for a moment to the issue of workforce. All aspects of national health reform need to be underpinned by one important overall area of reform, which is workplace. By workplace or workforce reform, I'm most particularly referring to the lifeblood and backbone of the health system, our doctors and our nurses. The government's committed to training more GPs to better equip our health workforce for the future. We're investing $1.8 billion in training more GPs and medical specialists, providing better support to nurses and allied health professionals. The government's committed over $600 million to train a record number of doctors, to tackle shortages and to expand workforce capacity. Over the next 10 years, we'll deliver an extra 5,500 new or training GPs, 680 medical specialists and 5,400 training places. The government's also investing $390 million to support nurses in general practice. That'll mean that practices are able to employ nurses to the full scope of their ability as an integral part of the team in managing patient care. I want to acknowledge that the part that General Practice Registrars Australia is playing in this work. GPRA has had a very important role in bringing about improvements to the management and training of GPs by representing your interests. The Australian Government continues to provide financial support to GPRA in recognition of the importance of that representative role. I'm very pleased to be able to say that more doctors and medical graduates are training to be GPs than ever before. All of the funded training places that were available this year have been filled, which is a record take-up. The government's delivering on its commitment to expand general practice training to provide 1,200 places every year by 2014, more than doubling the number of places that were available in 2008. General Practice Education and Training Limited and the 17 regional training providers have the important job of implementing that expansion in GP training places. GP is exploring innovations to support the growth and demand for GP vocational training. I'm encouraged to see that you'll be discussing innovation in general practice in your session later today. I can't talk about the issue of workforce reform without raising the initiatives we have to encourage GPs to go and live and train and work in regional areas. The AGPT program requires that 50% of all training must be in regional and rural areas. That's very important because we know that doctors who go and train in a rural or regional area are more likely to continue working there when their training finishes. I was talking to one group of GPs who were urging me to sponsor a program, GP Needs a Wife, or GP Needs a Husband, showing the gorgeous lifestyle that they have. I think that was in Tamworth actually, and they're trying to think of how to attract GPs to Tamworth. But it is actually, for people who have experienced living and working and training to start with in a rural setting or a regional setting, it is a very appealing life, and people don't realise quite how appealing it is until they go there and perhaps fall in love with a farmer and settle down. Working in rural and regional areas is also supported by the General Practice Rural Incentives Program, which provides retention payments of up to $47,000 annually to eligible GP registrars. What that all adds up to, I hope, is more doctors for the bush, just as Tanya Agnes was saying this morning, and of course that's good news for all Australians. The government's also expanding the pre-vocational general practice placements program from around 400 places in 2010 to 975 from this year onwards. That's a $150 million commitment to encourage junior doctors to take up general practice as a career and experience working in outer metro and regional areas through supervised placements before they become fully fledged doctors. With all of these many initiatives in play, I hope it is clear that we as a government very much value the role of general practice in the Australian health system. We want to make sure that every Australian can get quality health care where they need it, when they need it. And with that commitment, I look forward to working with you, today's GPs and tomorrow's GPs,